Hello and welcome to Dartmouth Health's Heads Up, a year-long mental health awareness journey. This is a webinar series which focuses on important mental health topics that affect all of us. I'm Audra Burns from Dartmouth Health and your moderator for this series. Today we will discuss mental health and the criminal justice system, and I have three perfect panelists for this topic. Joining me first is Chief David Goldstein. He is the Chief of Police in Franklin, New Hampshire, and also a psychologist. Welcome, Chief.
Thank you very much. Happy to be here.
Next, we have Dr. Samantha Morin. She is Dartmouth Health's lead child forensic psychologist, director of the clinical services at Sununu Youth Services Center in Manchester, New Hampshire, and is the vice chair of the Juvenile Justice Reform Commission. Hi, Samantha.
Hi, Audra. Thanks for having me.
Great to have you. And rounding out this panel, we have Joseph Lascaze. He is a Smart Justice Campaign Manager, ACLU, and a criminal justice reform advocate. Welcome, Joseph.
Good morning. Well, thank you for having me.
Thank you for joining us. So the goal of this year-long series is to help change the conversation around mental health and to end the stigma that's associated with it. So today, as we explore the intersection of mental health and the criminal justice system, it's really hard sometimes to see where, one ends and one begins. So whether generations of stigma is built on a system that might further victimize people who suffer with mental illness and is poorly equipped to care for them. So meanwhile, law enforcement officers suffer disproportionately themselves with higher risks of suicide, and officers being more likely to die by suicide in the line of duty, according to the Center of Disease Control. So leading with that, let's start with Chief Goldstein. What can you tell us about how mental illness contributes to the crime rates and how the police departments and correction system in New Hampshire are responding to safety problems that arise from the mental health crisis?
Well, that's a very good question, and obviously a very complex one that requires a great deal of thought and input from virtually all sectors, if you will. And when we say criminal justice, I think it's very important, first and foremost, to realize that includes all aspects of the system, not just police, but the courts, parole, probation, corrections, et cetera. So that's important to keep in mind. The issue has been with us virtually forever. And it became worse back in the 60s and 70s when experts decided to deinstitutionalize individuals and move them out into the communities, where it was believed at the time that community mental health centers would be the catchment areas for individuals that were experiencing emotional difficulties. Unfortunately, as we've learned through experience and history, that didn't work. And we didn't have a plan B, so to speak. So we're dealing with that now. And in regards to that, the police have become, if you will, that line of individuals that have to deal with these situations as they develop in families, groups, individuals, or whatever, to the degree that we now utilize our prisons and our jails as mental health institutions, which we should not be doing. That's not what they were meant for. That's not what they were designed for. That's not what they were built for, but that's what they've become. So it is, as I say, it's a very complex problem that requires a lot of thought. Sadly, in the fields of behavioral science, 2 + 2 doesn't always equal 4. So you won't see a whole lot of Nobel Prizes given out for the behavioral sciences because of that, because it is so complex and it is very human in design.
And I think just having this conversation with you is gonna bring a light on what your officers are facing and hopefully continuing this conversation. So Joseph, let me turn to you now. Could you please share how your work intersects with the New Hampshire criminal justice system and why you feel it's necessary to do this work?
Sure. Thank you, Audra, for the question. As the Smart Justice Campaign Manager for the ACLU New Hampshire, I focus primarily on criminal justice reform work that will take place policy-wise in the legislature, also in the judiciary, and in the community. So I do a lot of work with directly impacted individuals of the criminal justice system that are transitioning back to the community. This involves mentorship, helping them establish their support system out here, as well as diversion work for youth that are involved in the criminal justice system.
And can you tell us a little bit about your personal background and what truly, inspired your work?
Sure. So the reason why I have excuse me, this drive for this work is I myself am justice impacted. At the age of 17, I was arrested, certified as an adult, and then I entered into the New Hampshire criminal justice system, and I experienced 13 years of that. So based on everything that I've gone through, from arrest through the courts and then through corrections, through the parole department, and then making it back to the community, there was a lot of reforms that I saw that needed to take place, and I wanted to apply the knowledge that I learned. And with the things that Chief Goldstein was saying, the correction system has become the #1 place for treating individuals who are experiencing a mental health issue, and that is not really the environment where they should be treated.
Thank you so much for sharing that. Truly an incredible advocate for what you're doing. This is fantastic. And it leads me to just one follow-up question on that as well. It sounds like you don't think that the youth mental health are being addressed adequately. So what would you say are some alternative ways that they can be more effectively addressed?
So one of the things that's happening is we have to look at the environment of the incarceral system, and the juveniles, when they are entering the system, specifically for the first time, we know that a juvenile's mind is not fully developed yet. Not all aspects of their decision making are formed. And when we are taking them and putting them into an environment where they are exposed to all different types of perspectives of the criminal justice system or views of law enforcement or criminal behavior, I myself, it's easy to go down a path where that behavior that you end up internalizing is not the intended outcome of the system that we're putting these juveniles through.
So for our viewers, Joseph is doing incredible work. So we'll be sure to link to some websites and some resources that Joseph has in the link at the bottom of this video. Joseph, thank you for your incredible work. Let me turn now to Samantha. So through your work at the Sununu Youth Services Center, can you kind of paint a picture on what the typical child is that you treat, and how does mental health play a role in the decisions that maybe led people to enter the juvenile justice system, and how are those mental healths being addressed, while in the state's care?
Great question, Audra. Thank you. So I'm going to abbreviate Sununu Youth Services Center with SYC. It's just a little easier to say. So the typical youth that we have, and I say typical, but they're all different, and it's all individualized what we try to do with the kids while they're with us. But on average, youth are between 13 and 18, on average about 16. And I think one thing that's important to point out is many of the youth come to us having already been involved in either child protection or a child in need of service petition, or have gone through multiple placements before they've come to us, on average about 5 or 6, and have a lot of trauma in their history. So we have a lot of abuse, a lot of neglect, a lot of trauma reactivity that contributes to maybe some of the behaviors that led them to be placed with us. So a lot of mental health challenges that we're seeing with a lot of the youth coming in. Sometimes when they're with us, it's the first time maybe they're engaging in therapy, even though they've been in a few placements, things like that. So to speak to what Chief Goldstein was saying, where the justice system ends up also being, where they're getting their mental health treatment, unfortunately. And then, to speak to what Joseph was saying, we are getting kids in this period of adolescence where they are naturally impulsive and, their brains aren't fully developed. They're not thinking about the consequences of their actions necessarily. And then you put on top of that the trauma they've experienced, the mental health challenges, and you take them away from their families and their community and put them with us. So our focus is really on trying to help rehabilitate these children, give them the treatment they need, try to help them with coping skills. So maybe they'll leave us and not return, because we know the further in the system a child gets, the further they stay. So that's, to answer your question, kind of the kind of kid that we see here at the center.
I think you're doing fantastic work over there, and we'll be sure to link to the Sununu Youth Services Center because I think it's important for people to know the work that's being done over there. So that link will also be at the bottom of this video. So Joseph, let me turn back to you now as a smart justice campaign manager for the ACLU. You really looked at ways, policymakers can change the criminal justice system to be more equitable and less destructive to vulnerable communities. So how do you truly envision a better justice system?
That's a great question. It's a, you know, it's a big one. And I think that when it comes to a better justice system, there's three bucket areas that we need to start focusing our reforms in. And one of those areas involves, police and community member interactions. We need to have healthy, positive interactions between law enforcement and community members. And one of the ways that this can happen is by having mental health professionals as accompanying responders to call to service requests that police departments get when they involve people that are experiencing a mental health crisis. When we start looking at some of the data that has come out involving fatal shootings, we see that half the people that have been shot by police do have a disability, according to NAMI. And we need to, as a society, just have a less violent and less combative approach to these responses when we can. That we need to make sure that police departments have other tools. So having mental health professionals that can also be there to diffuse situations and identify individuals that are experiencing certain health crises and walk them through it would be a great start. Also, we need to have some judicial reform. We need a system that's just going to work with the individuals that are going through it, not a one-size-fits-all approach. Looks like drug courts, using drug courts more, mental health courts, the diversion programs that we have in our state. Those all allow rehabilitation to take place on an individual level. And in my experience, that has been the most effective approach to correcting behavior and having youth and adults pursue a better life out here in the community. And finally, I think that there needs to be some structural reform when it comes to jail and prisons. We need to just stop warehousing mentally ill people in jail and prisons. That's not the environment, that's not the place that we need to be keeping them. We need to stop utilizing the prison system as a treatment center. We should also focus our resources on individuals who require a different level of care, rehab, and community security, while also approaching alternatives to incarceration as a whole. The youth that I mentor, I see a lot of the same, hindsight's always 20/20. So looking back now, I see a lot of the things that they experience when I'm talking to them. I see that there is a different approach to help them see a better way of decision making, of approaching the decision making, other than the incarceration system. And I think that we can utilize those approaches.
That's really wonderful. I think you echoed, just what Chief Goldstein was saying about prison is not the place, and just for your advocacy work and helping to elevate this conversation and really get it out in the forefront for people is going to hopefully help the work that you're aiming to do. So Samantha, what is changing in the treatment of kids at the state's juvenile justice program that you can speak to?
So there's a lot of great reform going on in the country in juvenile justice and also in the state here in New Hampshire. So in my work on the Juvenile Justice Reform Commission, in all different facets, so not just juvenile justice at SYSC, but also probation on the child protection side and the community. So they're really trying to rebuild our system of care. The Department of Youth, Child and Families, DCYF, Department of Child, Youth and Families, DCYF is really working hard to build up our system of care, bringing new interventions into the state like multi-systemic therapy, which research shows works really well with high-risk kids. They're also doing assessments, needs and strength assessments with youth now, using an instrument and evidence-based tool called the CANS. So all child brought in get that assessment. They're doing level of care assessments as well with kids to make sure that they're in the correct level of care and trying to keep them in the community as much as possible and build up some of those resources. And then if, it does get to the point where a youth is placed with us at SYSC, we've been doing our own transformation the last few years that I've been here, and moving the culture from more of that punitive mindset to a really treatment-oriented approach. So we've been implementing a lot of evidence-based, trauma-informed care here at the center. We have individual therapy, we have group therapy, including anger management, dialectical behavior therapy, social emotional learning. We're getting families involved, having them come to treatment plan meetings, visits, just really trying to, give the youth the treatment that they need if they are here, trying to keep them in the community. But if they do have to come to us, giving them some of that treatment and trying to make it an atmosphere that's more treatment and trauma oriented, to help them develop some skills they can take with them when they leave us and reintegrate into the community with their families.
That's fantastic. Thank you for sharing that sort of background and insight on truly how you're readjusting things. And we'll be sure to link to some things you mentioned about trauma-informed care and different, therapies that are available. Joseph, you mentioned NAMI. So we'll make sure those are as well linked in this video, because I think there is resources out there. We want to make sure our viewers have access to those. So Chief Goldstein, I want to turn to you now. The work of law enforcement officers and other, first responders leaves its mark on the mind and souls of the men and women who do this work, as you know. So how have you seen the culture around mental health among police officers change, and what improvements can be made to ensure that they have the support that they need?
That's a very good question, and I appreciate that question, something I've been working on now for over 40 years, quite frankly. And the reality is that we have evolved a lot relative to this subject. We're looking at it more realistically now, insofar as that we are still human beings, whether we put the uniform on or not, whether we do this for a job or not. We're still members of the human race, and as a result, we still have those shortcomings and weaknesses that every human being has. But at the same time, we have those strengths and abilities that many human beings have as well. So we're looking at things like critical incident stress management for police officers, which includes critical incident stress debriefings. We take these critical incidents that we're involved in and we dissect them, and it's a legitimate group process where we use trained groups, trained individuals, certified individuals to do this in conjunction with mental health professionals, licensed mental health professionals. So we're looking at this, but the reality is also that there aren't enough of us to go around. If you look at the statistics, they're kind of scary. For a country of almost 350 million people, there are less than 700,000 police officers in the United States, which means we're busy all the time. The small city of Franklin, there are 13 cities in the state of New Hampshire. The largest is Manchester, the smallest is Franklin, but we're all still cities. And my department handles almost 30,000 calls for service a year. Now, that's anywhere, a call for service is anywhere from a barking dog to a homicide and anything in between. So, but my officers have to handle those situations virtually on a daily basis. And when I put out only 3 officers on a shift, 1 supervisor and 2 officers, start to do the back of the envelope arithmetic. And you'll see that people are very, very busy. They're exhausted. They don't have the tools. We don't have the finances to meet the needs oftentimes of the communities that we serve, all of us, quite frankly. So especially with some of the issues we see today, the hiring, the retention, et cetera, all of these things that we're sharing with the workaday world. So it's a very complex problem, and it's something that deserves ongoing attention, which we are doing. But I can say this with all sincerity, we have evolved. We're not just changing, we're evolving. And we're taking on new roles within the community. We are working more closely with mental health professionals. We are working more closely with our communities. There are a number of initiatives out there that are helping us to be able to relate to individuals and their problems. And that includes our own, quite frankly. So for the purposes of this, certainly it's a much more in-depth type of conversation, but one that I can certainly assure everybody we're intimately involved with.
Well, you and your officers are doing incredible work. And I think the two things that you pointed out, I think are important about this is evolving. It's not something that's going to be figured out overnight. And you all are doing great work to try and chip away at this. And we also, I will link to them at this video. We have the 988 number as well as our mobile health crisis units. So I think it's important for people to understand that there is other touch points. So we will link to that information at the bottom of this. And that was great what you said, Chief, about you're all human. You're not only officers, but you're all human, just like everyone else. And so taking care of your own mental health needs and being aware of them is so important so that they can be prepared. So thank you for sharing that. So we're almost at time. And so I just kind of want to wrap up with, what's one key thing for all of you that you think is really important to take away from this conversation? So Joseph, I'll start with you.
Oh, thank you. I think that we just need to remain intentional of creating alternative and more humane approaches to treating community members that are experiencing mental health related issues other than the incarceration system.
It's a wonderful point. Thank you for that. Chief Goldstein, what would you like to wrap up with?
I'm going to be a little bit off script here with that. As an old-time polygraph examiner, we love analogies, and I'm going to use an analogy from my passion. And my passion is I enjoy jumping out of perfectly good airplanes, and I've done it about 2,500 times. And we have an expression in skydiving: we work the problem to the ground if we have a problem. We can't give up. We can't stop. It's got to be first and foremost on everybody's list. In order to solve these problems, don't just come to me and tell me there's a problem. Also come to me and give me an idea as to how we can solve it.
That's incredible advice and last words for this. And I think that our viewers hopefully will take that away. And all three of you are doing that incredible work. So we're thankful to have you. Samantha, let's wrap up with you. What are your final thoughts?
Thank you. This has been wonderful listening to Joseph and Chief Goldstein and learning more about things. So I think my big piece, I just want folks to remember that kids in the juvenile justice system are kids. And oftentimes they're kids who have gone through a lot of really rough things in their past. And so focusing on the fact they are children and they do need the help of adults who can provide them a safe atmosphere and the trauma-informed care that they need. And that's what we're trying to do. And we're moving in that direction in the state. But, we still need help and resources in the state to continue to do this work.
Yeah, and breaking down the barriers and bringing the awareness, I think, is just one little thing that we're doing with this Heads Up series. So thank you for sharing that. So Chief Goldstein, Joseph, and Dr. Morin, thank you for joining me today.
Thank you very much.
Thank you, Audra.
Thank you.
So to view past Heads Up segments and to access additional information and some of the resources that we mentioned earlier, visit the webpage that's listed in this video description. Thank you so much. Stay healthy, stay safe, take care.
You too.
Bye.